Hey everyone, today we are diving into something that impacts so many people but isn't always talked about enough: panic disorder. Maybe you have heard of it or you have experienced it, but today we'll be breaking down everything you need to know, including what a panic disorder really is, the symptoms, and the science behind it. Plus, I'll share ways you can start to cope if this is something you struggle with personally. So grab a cup of tea, take a breath, and let's get into it. Let's start with understanding what panic disorder actually is. According to DSM-5, panic disorder is characterized by recurrent, unexpected panic attacks, episodes of intense fear that peak within minutes. These attacks bring physical symptoms that can truly be terrifying if you don't know what's happening. Think rapid heartbeat, sweating, dizziness, shortness of breath, and even a fear of dying. Many of us have experienced moments of panic, like giving a big speech or being in a dangerous situation. But panic disorder is different. It's the feeling of your body going into a crisis mode when there's no actual threat. People often say it feels like a heart attack. In fact, 25% of all emergency room visits for chest pain actually turn out to be panic attacks. So what causes these attacks? While we don't fully understand every aspect of panic disorder, researchers have discovered some key factors. Let's break it down into 3 categories: so biological, psychological, and then behavioral. The biological. First, let's talk about biology. Studies have shown that there's a genetic component. If you have a close family member with panic disorder or phobia, your chances of experiencing it increases. Neurotransmitters play a role as well. Those with panic disorder often have imbalance in serotonin, norepinephrine, and chemicals that affect mood and alertness as well. The amygdala, which is our brain's fear center, is also more sensitive in people with panic disorder. So when the amygdala overreacts, it sends signals to the rest of the body to prepare for the danger, even when there isn't any. On a psychological side, a lot of people with panic disorder develop a fear of fear itself. Imagine you have had a panic attack in public. It was so embarrassing, maybe even terrifying, you start worrying that it will happen again. The fear and the anticipation can actually make you more likely to happen in the future. It's a feedback loop that feels impossible to escape. One of the biggest challenges with panic disorder is the tendency to catastrophize. When you feel your heart race, it's easy to think, I'm having a heart attack or I'm losing control. The mind interprets normal bodily sensations as a sign of catastrophe, and this keeps the cycle of panic going. And now there's behavioral side. When we experience something unpleasant, it's natural to want to avoid that. People with panic disorder often start avoiding places or situations where they had a panic attack before. Avoidance might help you better in the short term, but it reinforces the idea that those places are dangerous. Over time, this can make the world smaller and smaller. Another behavioral is relying on safety behaviors. These are the little things we do to try to prevent that attack, like carrying water bottle or sitting by the exit or having someone come with you everywhere you go. But instead of providing true safety, these behaviors can actually make you less capable of handling situations on your own. So how do we break the cycle? Let's talk about the solutions. I'm going to give you a quick tip here. So if someone is having a panic disorder, a panic attack, you can take your finger or any object and put it across your finger, and first look at the tip of your finger and then look right across that, and then bring your attention back to the tip of your finger and then right across it, and do it multiple times. This can help with the attack. So one of the most effective treatments for panic disorder is cognitive-behavioural therapy, or CBT. We learn to challenge these catastrophic thoughts. So when you feel your heart racing, instead of thinking, I'm going to die, you learn to say, this is my body's response to stress. I have been through this before and I'll get through it again. Inceptive exposure is a powerful technique used in CBT to help with panic disorder. It's about exposing yourself to the sensation of panic attack in a controlled way. For example, you might intentionally spin around to feel dizzy or run in a place to get your heart rate up. Over time, this helps you become desensitized to these sensations and reduce your fear of them. Another crucial aspect of recovery is reducing avoidance and safety behaviors. We do this by gradually facing the feared situation in a controlled way. We call it exposure therapy. By repeatedly confronting what we fear, we begin to see that those situations aren't actually dangerous. And little by little, we regain our freedom. So if you're struggling with panic disorder, here are some things you can start doing today to feel a little bit better. Breathe deeply. Slow, deep breaths can help reduce some of the physical symptoms of panic. Breathe in slowly through your nose, hold it, and then breathe out through your mouth. Grounding techniques. So focus on something in your environment. Describe it in details. Engage with your sensation. This can help pull you out of your head and reduce that panic. Challenge negative thoughts. When you feel panic starting, ask yourself, what am I really afraid of right now? Is there evidence to break this up? Often you'll find that the fear is sometimes exaggerated. Now there's this exercise for you. So physical activity can help lower overall anxiety level by using excess adrenaline and releasing endorphins, our body's natural stress relievers. So panic disorders can feel isolating, but remember, you're not alone. Many people deal with it, and there are effective treatments that are available. If you're looking to learn more about panic disorder or want to take the next step towards managing it, I'll love to help. As someone on this journey to become a psychotherapist, my mission is to support you in reclaiming your life from fear. And hey, if you know someone who might benefit from this video, share it with them. Leave a comment about your own experiences or what has helped you cope in the past. I would love to hear from you, and let's keep this conversation going. Thank you so much for watching, and take care.